Hello and good evening and welcome to tonight, where we're going to hear about why and how Myeloma UK is creating a hopeful future for their patients. The last year has been such a tough one. And I really feel strongly for those of you who've had to cope with the worry and uncertainty of shielding on top of living with myeloma. As more people are vaccinated, of course, it feels as though perhaps we can see an end to this, but myeloma patients and their families are still going to need extra support. This pandemic has had a huge impact on all cancer services, and this is a real concern for everybody at Myeloma UK. Because like you, we have seen firsthand how these changes have affected treatments. Appointments have been delayed or changed, and patients have found themselves not knowing what their future treatment and their care might look like. Myeloma is already taking action to protect patients' futures, but we do need to work faster and harder than ever before. We need to make sure that every patient is diagnosed as soon as possible and gets the right care and the right treatment, no matter where they live or what stage their myeloma is at. And we can only do this because of the wonderful people who donate money and fundraise for us. That money is needed today more than it ever has been in the past. We thank you for your amazing support so far, but if you haven't already done so, there is still time to give what you can and help us change the future for patients, their families, and their friends. Please help us to make their future a hopeful one. Thank you.
Thank you so much to Maureen Lipman, and welcome everybody to Myeloma UK's Creating Hopeful Futures event. Thank you so much for joining us. I'm Suzy Klein. I'm going to be hosting this evening's event. We will be talking to our guests this evening about the legacy of COVID-19 on the myeloma community and what Myeloma UK is doing to combat that. If during the event you would like to chat with one another, you can use the chat box. If you have questions for us, just use the Q&A box, which you'll find at the bottom of your screen, and we will put your questions to our guests a little later on. But before we get started, we're going to hear from some patients about the impact that the pandemic has had on them.
Getting on a tube train with lots of bags, door closed on my arm and broke my arm. It broke far more easily than it should have done, and that really was the trigger to the investigation into why that happened, that eventually in early August 2017 led to the myeloma diagnosis.
I had a massive back spasm, and that started the ball rolling to be diagnosed with myeloma in 2019. It's an eye-opener of who's around you and who's supporting you and what's there for you.
Couldn't drive, I had the shakes, I had blisters around my face, couldn't feel my legs and hands. So some of these symptoms are quite common with people with myeloma on treatment, but for me that was really restrictive, and I was really quite frightened, and I was really in pain. So I think with lockdown, that changed the conversation from what treatment are you on and how is it affecting you to have you been out recently? You know, can you go out? Where do you get your shopping from? Your food shop, who's doing that for you? I became very acutely aware of who I was in contact with, or if I walked past somebody when I was doing my walks early in the morning, to try and avoid people. Are they carrying something? You know, you look suspiciously at people. And then my myeloma started returning from January this year all the way through to June. My myeloma increased and I became increasingly ill. You know, more bone pain, lethargy, or fatigue. And I was worried because not only was I worried that I couldn't get onto treatment, but we also had COVID to deal with.
And being told that you have a cancer that's treatable is brilliant, but you've got to get through in your mind how that works. You're not going to die straight away. You're going to survive this. We're going to look after you. We're going to treat you. We're going to make you better. But then COVID comes along, and getting COVID is so dangerous to any kind of myeloma patient that it could kill you. And I was at the beginning of having a transplant ready when COVID hit, and it's just been paused. It was too dangerous for me to have a transplant. And it's devastating knowing that you've done 6 months worth of chemo, 6 months of work and prep, and going through hell in your mind and your body to be told that it's going to be delayed, but we don't know how long.
The first time that I became aware of Myeloma UK was at the time that I was given the news, if you like, and that was obviously with the consultant and with the clinical nurse specialist, and very much it was, there's the diagnosis, this is the treatment plan that we're going to put you on, and it was backed up by a whole collection of information about myeloma and about that treatment plan. That was all provided by Myeloma UK. Incredibly clear, incredibly well written, particularly during the early stages of diagnosis, when you're trying to come to terms with some pretty life-changing things going on.
Knowing that there's a charity dedicated just for your cancer was quite, not a shock, but reassuring. And I actually felt supported just by them being there. I just felt like I'm instantly supported by a community, and that when I need and if I need, and if any of my friends and family need, they're going to be there for them.
The unique thing that they bring is their focus on myeloma specifically. So if they weren't there, it wouldn't have that very specific, focused interest that's so relevant to us as patients, because there's nothing better than being able to look at something and say, yeah, that's what I've got. That's absolutely specifically what I've got. And be able to learn from that and encourage that, and hopefully look at the successes that they get from doing that.
Research and development, and that's going really well each year for myeloma. It's fantastic, and it gives me hope that I will live longer than the 10 years that I've been given.
Everybody in our group would always say, go to Myeloma UK. If you want to speak to someone, you can. If you need information, it's there. And it's there for every part of the myeloma journey that you're on. Rather than just, oh, it's myeloma and here you go. They can be very specific and very granular about speaking to you as a person, and that's what I like, and I find them really supportive. I'm on a treatment now that wasn't available 2 years ago, so that's how quickly things can move, and that's through the support with Myeloma UK. Even if you can find a new treatment that you can give someone that gives them better quality of life, whatever part of the journey they're on, that's got to be good news, and I'm living proof of that right now.
Paul, Scott and Carmen giving us just a little insight on what living with myeloma is like. Well, I'm delighted that Scott is going to be with us during this session. Hi, Scott.
Hi.
Scott was diagnosed with myeloma in 2019, and I understand you are a keen artist. Is that your that your optimistic blue sky behind you? Is that one of yours?
It is one of mine, one of many that I've been doing since in lockdown. So I've probably been more productive in the last year than I have done since getting my degree.
Now, you were talking in that film about how impossibly difficult it was to have done all the prep for the stem cell transplant and to have that cancelled. Have you had that done now?
I have. I was diagnosed in September 2019. Started treatment straight away with 6 months of chemo, and on March the 9th was it was a day of many, actually. It was the last day of chemo for me, so we had a little celebration, but it was the last time I went into an office. I was on the tube, I was on public transport, in a supermarket, etc. And lockdown happened quite quickly, let's say a week after. It was announced quite shortly after the transplant that was planned for me in late April was going to be delayed, and we had no idea when. So I was ripe for the stem cell harvest, which you probably all know about, but instead of doing 2 weeks of prep or a week of prep, we had to do that in 4 days, and that was quite painful. And then I had 3 months waiting to hear during lockdown, whilst being completely isolated with my partner in our flat, and learning of the dangers, learning of all about COVID like everybody. But I had a 3 months wait, and that was quite anxious. And so I had my first transplant in June, on the 30th of June, and then my second in October.
And how are you feeling right now?
6 months after my last transplant, and I'm feeling really good. I'm probably feeling better than I was pre diagnosis. So I don't feel tired as much. It takes a long time to get your energy back when you've had a stem cell transplant, and having a tandem is probably taking a little bit longer. But I'm walking 10,000 steps every day. I'm doing up to like 60 kilometers walking a week. So I'm really pushing myself, but I feel really good.
Carmen was talking about everybody being on their own myeloma journey, but everybody, in a way, everybody's journey has been similar since March of last year, because hitting the pause button on treatment and interaction and community and support has been devastating for sufferers of myeloma. Can you talk a bit about how you coped with that?
At first, really in a calm way. I couldn't do anything about it. I've got a great partner of 20 years, Tris, and we've worked together every day. We live together, so we were really we kept calm, and we have got great friends and family around us. But as the months were going on, and as lockdown was being eased for political reasons, or there was going to be a rush of people going out to eat out and to help out, my anxiety levels were going up, because I didn't know what was going to happen. I was really scared about going outside the house, with just even going outside, not even now you can wear a mask, etc. So no one knew what was going to happen, and having COVID for a myeloma person it could end them. So having gone through that, and then being told you're going to have a transplant during a global pandemic, where your immune system goes to, as I would say, a newborn baby in an incubator, it was kind of terrifying. But I had a great cancer team at Guy's Hospital, and my transplant was done at UCLH, and I had a great team there, and the nurses and the consultants were fantastic. So any questions that we had, any kind of problems that we had, we could call them. And probably one of the worst things was not having your partner in the room during the consultations. But the doctors were like, right, let's get Tris on the phone. Let's make sure that you're supported that way. So they were really accommodating, and I felt safe once I was in the hospital. So I felt really secure and safe. Everybody really did, everyone was wearing their PPE. I was in a separate room during the transplant, and there was a double door system to my room, and they'd have to change their PPE. They'd have to wash their hands. So I felt really protected.
I want to bring in Professor Graham Jackson now. Graham is Clinical Director of Haematology and Bone Marrow Transplantation at Newcastle Hospitals Trust, and he's a Senior Lecturer of Haematology at Newcastle University. Graham, welcome along this evening. Is Scott's experience, it must be pretty typical of what was happening for all myeloma patients last year?
Yeah, Scott has been so eloquent in how he's talked about the things he's faced. And I think we as physicians have been incredibly aware of how difficult it's been for myeloma patients. Not only are they dealing with a difficult diagnosis, they're dealing with changes in treatment, they're dealing with the fear of the disease. And as Scott's nicely said, isolation from people. And when he's been in hospital, isolation from his partner. And all of these things are really, really difficult to deal with, as Scott's brilliantly illustrated. And we on the treatment team side have been astutely aware of all of the difficulties they've faced. I think we've tried to act as quickly as possible to make changes, to make things as safe as possible. And again, Scott very nicely said PPE, making sure that when patients are in hospital, they feel safe. Making sure that any changes to their treatment are done not to detract from their therapy, but to make their therapy safer. And so people have been working incredibly hard, and Myeloma UK has been at the heart of that. But Scott's story is so typical, and it's just been so hard to watch our patients go through such a difficult time.
What does the picture look like as of today in terms of access to treatment? Do you feel optimistic?
I do feel optimistic. First of all, I would say that there have been changes made to treatment pathways, which I must emphasize are made to make things safer, not to make the therapy less effective. But there is certainly a sense that things are returning to normal. And as Scott has said, he's gone through his transplants now. Here in Newcastle, we're transplanting normally. But very importantly, emphasizing to our patients when they come in, when they leave their home and their cocoon of safety, that we make them feel safe too. So that's all very, very important.
We also have with us this evening Laura Kerby. Laura joined Myeloma UK as the CEO last May, just when the pandemic hit. What a time to take on that huge new role, Laura.
Yes, it was a very interesting time to join an organisation that had just gone into a firefighting mode with very high demand on services. So, 249% increase in our information line, our nurse service, and patients quite rightly confused, anxious, and trying to get any information that they could to understand what they needed to do next, whether it was treatment protocols, protecting themselves through shielding. And Myeloma UK had to work very hard to make sure it kept up to speed and pace with all those changes that were happening throughout all the going into lockdown and coming out of lockdown. So a really interesting leadership challenge to come on board and support the effort. And the team have done extraordinary work throughout the last 12 months.
And did it just involve people working ridiculously long hours, or did you have to garner all sorts of extra bits of support? How did you as an organisation deal with that constantly evolving challenge?
So I think, in a number of ways, I think we put patient at the heart of everything that we did. So very focused on patients, making sure that resources were deployed to frontline so that patients got the service, the information line was answered, the information was accurate, that we made sure that we took all our information days digitally. And in fact, we reached 5 times more people in 2019 by going to digital in terms of reaching patients and families. And just an extraordinary effort on behalf of the whole team to really make sure that patients got what they deserved and what they needed. So just will and skill, I think, Suzy, is the answer to that one.
We've had a tiny bit of a sense already of what it must have felt like for the people who already had their diagnosis. I think what has been of huge concern to so many people is the lack of early diagnosis of all sorts of cancers, including myeloma. Graham, what's been your take? How concerned have you been about the lack of possibility of early diagnosis, and how do you see that carrying on in the future with the follow-on effect and the impact of COVID?
So Suzy, always been a long-term concern for those of us dealing with myeloma. As I'm sure you know, myeloma, it takes the longest from first symptoms to being diagnosed. And I have no doubt that's been stretched out by the pandemic. And we're working with Myeloma UK, and we're actually doing something tomorrow with the BMA to try and educate doctors to get patients to us as quickly as possible, because the sooner we get the patients, the less damage the myeloma can have done to their bones and their kidneys. So we are working really, really hard, but undoubtedly there has been a concern that the delay to diagnosis in myeloma, which is already way too long, has become longer because of the pandemic. And that's something we've really got to work hard at. And Laura and her team working amazingly hard at helping us to do that.
Laura, we heard from Carmen in the film about a new treatment that she's on as a result of a clinical trial. How important then are clinical trials for myeloma patients?
So they're extremely important, Suzy. And when we talk about hopeful futures, we're talking about making myeloma history, and this is one of the ways that we'll be able to do it. And survivorship is absolutely vital whilst we go about finding that cure. A clinical trial can give patients access to treatments up to 10 years before it becomes available on the NHS. At Myeloma UK, 1,100 patients to date have benefited from that early access through our commitment and funding of clinical trials. So it's really important. There has been disruption due to COVID-19, and it's critical that we get them up and running as soon as we can. We're working with the Association of Research Medical Association to try and get a seat to push those trials, and also make sure that where there's conflicting priorities about funding, that money does go towards myeloma and does go towards myeloma trials, not just the tumour cancers and other cancers, because it's very important that that work continues. We ourselves continue to fund our CART programme, which encourages early phase trials, and that has been set up. We've been investing in the infrastructure to attract researchers. We're very pleased that the University of Leeds unit have actually attracted a couple of new trials, and that's great news for myeloma patients. But it's hard, and we really need to make sure voices are heard from patients about the difference clinical trials make, and make sure funding comes myeloma way.
Graham, what's your perspective on the importance of access to clinical trials for patients?
Oh, Suzy, it's vital. All the progress we make in multiple myeloma, and there has been considerable progress in the last 10 years, is down to clinical trials. And Laura's right, Myeloma UK has been at the heart and soul of the UK as a real important research hub in multiple myeloma. And we've done some amazing studies here in the UK. And by doing a lot of clinical trials, you attract new therapies earlier for our patients. And as Laura said, our patients have been able to access drugs they wouldn't otherwise have been able to access because of that investment in early clinical trial work. And that bears fruit in terms of treatments coming online earlier in the UK than they otherwise would have done.
Scott, I can see a nod of sort of hopeful recognition from you. I imagine from a patient perspective, that's exactly what you want to hear, that those possibilities might be there for you and for other patients.
Absolutely. I've just been put on a new course of drugs which have been approved by NICE, and I'm on day 3 or 4 of that. So and it's Len, we call it Len, don't we? I can't pronounce it. I can never pronounce these drugs. But
Graham probably can.
So if I could butt in, Scott, lenalidomide maintenance, which is what you've started, is a real UK success story. Myeloma UK fought for it. It was a UK clinical trial. And actually, even amongst the dark days of the last year, we've had 3 new therapies approved thanks to the work of Myeloma UK. And you were on that treatment, which a year ago, you wouldn't have been able to get. So I'm delighted you're on it, mate, and that's really good.
I was on it last year during what I was calling top-up chemo for the 3 months, and I was told that I asked when my anxiety was high, like not knowing when the transplant was going to be, how long I could be on this, and they said indefinitely. So the only thing that's changed is instead of taking an aspirin, I'm now having to self-inject a blood thinner, and I've day 3, 4, I've not had any symptoms. But yeah, it's actually really comforting to know that, especially with Carmen's story, that she's been on a new drug and I'm on a new drug, and I think it's one cancer that actually is making progress for other cancer treatments around the world. So it's really encouraging. As one friend said, it's the right cancer to have. Congratulations. It's one of those things that I feel incredibly lucky.
Laura, it must be both really exhilarating when these trials are happening, when you're advocating and pushing and managing to get things over the line, and then at the same time enormously frustrating because you're having to compete, of course, with lots of other cancers that have bigger profile and you have a pandemic to deal with. I think what a lot of people don't realize is the speed at which cancer medicine for myeloma is developing all the time. I think it's probably a surprise to a lot of people, even with myeloma, that the treatments and the clinical trials are happening and developing at lightning speed.
Absolutely. If you think that in the 1990s, the survivorship of myeloma patients sat at somewhere between 12 to 14 months from diagnosis, and now that's quadrupled to 4 to 8 years, with 1 in 3 surviving 10 years or more. So that gives you an indication of the outcomes that Myeloma UK, with its community, with the fantastic work the clinicians do, and it's working together to get approval for drugs, actually is making a difference in quite a short period of time. We've gone from having no novel drugs available for myeloma to now having 8 available on the NHS, delivered across 12 different combinations, and that is what is driving that success. So, it's tenacious work. We have to work with bridge pharmaceutical companies, with clinical clinicians, with researchers, with patients, and it's our responsibility to make sure the patients are fought for. And if for any reason that process starts to fall away, we are absolutely committed to getting it going and doing everything we can through patient voice, through the patient experience, to make the drug available.
I'd like to talk about vaccines, if I may, because Graham, I imagine lots of people, lots of myeloma patients feel very confused and very anxious about vaccines. What do patients need to know?
The number one thing they need to know is have the vaccine. If you're offered it, have it, and take it according to the schedule you're offered. There is no reason why you're more likely to get side effects. That's the myeloma patients don't get any more side effects from vaccine than the general population, and as we know, the side effect profile is incredibly good for all the vaccines. One of the things we don't know is how our myeloma patients are going to respond to the vaccine. Those of us who are lucky enough to have a good immune system, we know our responses are likely to be very good. The unknown for our myeloma patients is how is their immune response going to be. So the myeloma community, and again, Myeloma UK at the heart and soul of this, are looking at how our myeloma patients are going to respond. And it's not beyond the realms of possibility that they might need a third dose to boost their immunity going down the line. But for now, there is no reason not to have the vaccine. Please do have the vaccine. Side effects are minimal, and it's very important. And we saw some really nice research just published this week from the Royal Marsden showing that antibody responses to the first dose in myeloma patients was really very good. So that's very encouraging news too. So have the vaccine. COVID's dangerous, the vaccines aren't.
I think that's a pretty straightforward, unequivocal answer. Thank you for being so clear. Laura was talking earlier about the power of digital and how digital forces had to be mobilized during COVID. It taps into that whole sense of loneliness, of a lack of community that everybody faces, but for myeloma patients, the extra pressures of that, having to shield, of not being able to meet up or talk with other people who are suffering from it, not having face-to-face consultations. Scott, how has the pandemic changed the experience, would you say, of being part of the myeloma community? Was that something you were ever plugged into? Is it something that you feel you would have liked to plug into, or did you tap into it digitally during the pandemic?
I knew it was there. So being diagnosed quite late into September 2019, the pandemic kind of happened quite quickly after that. So I hadn't had a chance to go meet people or actually do any of the things that you would probably normally have done. So I haven't actually gone to an event. I haven't gone wasn't really able mentally as well, or in the right mind space to be logging on to kind of the Zoom events as well, because I just really wanted to make sure that I was getting better. But it is definitely something now that I'm learning to, and I'm getting on with, and making sure that I am doing. But the strange thing is, it's knowing that they're there, knowing that myeloma community is there. And when I was given the diagnosis, I went back the week after, and I was given a whole load of literature, and the bright orange booklets stood out a mile, and they're really very easy to read. They are so knowledgeable on the side effects, and I was keeping them by my bed. And Myeloma UK was the only website I would look at, because I promised my nurse team guys, Grayson, that I wouldn't go online and look up the symptoms of anything else apart from trusted websites. And so Myeloma UK was the only website I would go on to. So the community aspect wasn't there, but the information was. And if it wasn't for Myeloma UK and the booklets and the online, I looked it up yesterday for some of the side effects for the new drugs. So I was using it in a different way rather than actually going out and meeting. But I know it's there. I've chatted to Paul, who was in the film, on Facebook, and he said that it's going to be a group soon when everybody's kind of ready to talk and stuff like that. So I know it's there, and I'd probably be getting on a bike or something soon enough to try and raise money. But I've got my own way of raising money rather than doing exercise.
Sounds good to me. Laura, how has the digital space, I mean, has it given you a sense of new things that Myeloma UK can do in the future after COVID?
Yeah, I think, I mean, just to touch on what Scott and Graham and I had a conversation on this, I think just to reiterate that the psychological side for patients has been incredibly hard. And things like support groups, who typically would get together in a hospital to, weekly, to peer-to-peer chat through patient to patient, a lot of that has been unable to do it. And so there's been a big gap that we've tried to fill, Suzy, but that face-to-face, that ability to talk to each other. We ran our first national support group conference, which was fabulous to get everybody together in digital, but we recognise that digital doesn't work for everybody. So I don't think it's a panacea. I don't think it's the only thing, but it does reach, and it saves people having to travel, and it reach further geographically than perhaps we're ever going to be able to, in terms of having information days across the board. I think from a medicine perspective, consultations, some patients have said having consultations with their clinicians, it saves them going into hospital, it saves them sitting in waiting rooms, it saves them time and effort when they're poorly. So I think there's some very good things that will come out of digital that will transform healthcare. But the face-to-face is so critical as well. And we are looking forward to getting back to that, because the importance of that human to human and the psychological support really needs to be reinstated as quickly as it is safe to do so.
I wanted to ask you, Graham, what you think Myeloma UK, what you would like it to do for patients in the coming year. What would be the best outcome?
I think that, look, I'm here, Suzy, because Myeloma UK is a fantastic organisation, and we heard beautifully from Scott and on the film how good they are at disseminating information. They're a great partner for clinicians as well as patients. So all the things that we've heard the patients say, we all say from a clinical point of view as well. Information, research, reaching out to people. We always direct our patients to the information that Scott's talking about. And Laura's right, it could be booklet form, digital form, face-to-face meetings, but they do it so well. So my message would be more of the same. They do it really, really well. Keep doing it. It's fantastic. And they're a great partner organization, as I say, not just for the patients, but massively important to those of us who work with myeloma patients.
but it's essential, Laura, for you to be able to do your work, to have the funding in place to support that. How hard has this last year been in terms of fundraising? I have a suspicion that I know what you're going to say, but go ahead.
I think the voluntary sector has been very impacted by the inability to run community events, and the social distancing has prevented a lot of our traditional ways of raising money, dinners or London Marathon, whatever it is. Our big London to Paris bike ride didn't happen. In some ways, we were shored up last year, Suzy, by our myeloma community, who were incredibly generous into our emergency appeal. And we had some legacy, which is rather sad given the circumstances, but it did mean that from a financial perspective, 2020 was shored up. But 2021 is going to be very difficult. That sense of emergency is gone. We're still in exactly the same position in terms of not being able to get people together in large groups to participate, have dinners, have something like this as an event rather than have people on digital. And so it's really important that people support as much as they can, because I think actually 2021 might be a tougher climate for charities, and particularly Myeloma UK, because we can only do what we can afford to do for patients, and that's directly linked to how much we raise.
I want to move on to questions because there are an awful lot coming through. I want to make sure we've got enough time to get through as many as we can. Chris has asked about the impact of lack of funding on research. What has the impact of COVID-19 been on myeloma research, and what research is being done into COVID-19 and myeloma? Graham, do you want to start?
Yeah, I will. I think undoubtedly at the beginning of the pandemic, some research slowed down, and clinical trials, nurses were often having to go off and work on COVID-19 wards, and there was redeployment everywhere. And sadly, clinical trials units were often ripe for redeployment. That said, things have come right back. Myeloma UK have helped us launch a new study in the elderly. There's several new studies coming online. So I think things are getting back to pretty much full steam for myeloma research, and there's a lot of really good myeloma research projects coming online. In terms of COVID-19, the whole community, including Myeloma UK, have really been assessing the impact of COVID-19 on our patients, not just physically, but psychologically. And you may not know, but Myeloma UK are at the heart of the research into how vaccines work in our vulnerable patients. So the research into COVID-19 has really been at a pace. And again, the UK, partly through Myeloma UK and the hard work of patients like Scott and clinicians, has really led the way in research in myeloma and the impact of COVID-19. So a lot of work.
Laura, do you want to add your perspective on that?
Yeah, I think as Graham's already said, our work at the Institute of Cancer Research under Professor Richard Holston and Dr. Martin Kaiser has pretty much continued. And that's very important work, Suzy, because what that's looking at is targeted medicine. So instead of a sort of standard treatment pathway, how do we understand genetics and changes in genetics and how drugs might be used in a more effective way? So that's really key part of myeloma funded research, and that in the main has continued. We worry a little that, again, as I said earlier, that money and funding won't be coming quite so freely, that there will be lots of competing priorities on it. I think Cancer Research UK themselves have had to cut funding quite significantly as an example of that. And therefore, as myeloma is a rare disease, it's very important that Myeloma UK fights hard and makes sure the voices of patients are heard to keep the great work and the increases in survivorship happening. And then just in terms of the vaccine, I think we're partnering with other charities in blood cancer. I think that's really important. It means we can leverage our funding to not just put money into one trial, but make sure it's across a number so that we can really understand the difference and actually get a meta-analysis which includes international data as well. The UK has been very speedily rolling out the vaccine, as we know, but in terms of getting baseline data, we've got to move quickly at pace to get that baseline data, as Graham says, before perhaps there's a change a booster or something else. So we're working very hard with our colleagues in blood cancer charities to make sure that funding is being made available to get that baseline information and data sorted out. So yeah, really trying to understand at a granular level how myeloma patients will be impacted by the vaccine. But to reiterate what Graham said, you know, there's some positive news this week with regards to the protection that might be offered to myeloma patients from the vaccine.
More questions coming in on the vaccine and COVID, of course, the hot topic for myeloma patients everywhere at the moment. Question from Elizabeth: will myeloma patients always feel very vulnerable to COVID? Graham, do you want to start?
I think that's an important question, and obviously that really comes back to what Laura said about how protective the vaccines are, and this is a work that's being done very rapidly. And I would echo everything that Laura said. You know, there's one thing you take out tonight: Myeloma UK are really at the world forefront of research into how the vaccines are effective. One of the things I would say is that one of the things we've noticed as a slight aside from COVID-19 is that because myeloma patients have become more aware of their risk of infection, we've seen a lot fewer patients come into hospital with other chest infections, and myeloma patients are very open to chest infections from other viruses and from people in general. And so what we might find is that we are encouraging our myeloma patients not to isolate, not necessarily to shield, but, you know, mask, hand washing, distance, watching out who you're socializing with might become more a part of their general lifestyle than it might have been a year ago.
Scott, I haven't talked to you yet about the vulnerability to COVID and how that feels as a patient.
It's quite shocking when I knew I was going to have to be isolating. I knew I was going to have to wear a mask last year anyway. So I wondered if I was going to get looked at by wearing a mask on the tube from going through the transplant. I knew I was going to have to keep away from large crowds, not go to a pride event, not, you know, all of these things. And then COVID comes along and everyone's isolating along with me. But then it's the extra steps of I've not hugged my parents, I've not hugged my brother. We've done door to door. They've sat at the door and we sat down further along the hall. So even though I've had a great group of friends on WhatsApp and I've seen my parents at the door, the isolation around kind of not being able to go into a supermarket or into a regular shop. I've not been into a supermarket for over a year and a bit. So there was a little hospital shop at Guy's, an M&S and WH Smith's, and I didn't know what to do in terms of I can buy anything, I can do anything I want. And there's going to be I joked about going out for the first time. It's like, I'm going to have to watch myself stepping out onto the road, because how do I, I might just get, bang, because I'll be listening to my music and not paying attention. So I think there's going to be a lot of things I'm going to have to be cautious of course. But I'm wary about going back on the tube, and I know that a lot of people will be. So even at the beginning of when I was on chemo and COVID was just creeping into the news and into the UK, Tris and I were going on the tubes at not the busy times, and we were already doing the hand washing. We were already kind of making sure that we had our own mugs and our own glasses in the shared office space that we were using. It's just amplified. And I think, I keep saying I'm quite lucky, but I think there'll be a lot of other people who will be not talking to as many people. They won't be communicating their feelings. They won't actually have gone outside as much as I've been able to, because either they're on treatments that making them feel really rubbish. And I was lucky to have my transplants, but there's a lot of other people that are just going to be going backwards into a shell. And that's what I'm worried about, that people aren't going to be communicating how they're feeling.
Thank you, Scott. Anne has been in touch to say her treatments have been changed. So can she avoid, so that she can avoid going to hospital so much? Will this affect her future options, Graham?
It's a great question. And what I would say to Anne is that all the changes that were made back in March, April, May, again, with the help of Myeloma UK and NHS, were made to keep the treatment as strong as it could possibly be, but keep patients away. And I think we have learned, Laura mentioned this earlier, that some patients haven't had to come to hospital quite as often. Telemedicine's come in, and that's actually been a boon to some patients, that that journey back and from hospital, I'm sure Scott would bear me out. It takes a long time from leaving your house to getting back to your house when you're on treatment. And sometimes just being able to do it from home with home delivery of drugs has really helped. But the key answer to Anne's question is it should not in any way affect your future therapies. And you can imagine, Anne, that Myeloma UK, the clinicians and everyone will be making sure that that does not happen. You will not be disadvantaged by the treatment you're having now impacting on you down the line. And I'm sure Laura would agree, we will work incredibly hard to make sure that does not happen.
Yeah,
Okay.
Graham, I was going to use the word lobbying, but that might not be appropriate right here. Right now.
I haven't got Boris's phone number, Laura.
You're the only person in the UK who doesn't, virtually.
But in that context, we are calling very hard on policymakers to for guidance on extending access to treatments that were made available via tablet or injection. So if people are not ready yet to go back into hospital, they at least have some choices. And so that's what we'll be working very hard on, Graham, as you know, and Scott, for you, we'll be working very hard for that.
We've probably got to do a very quick final question, which I think will be to you, Laura, which is, how will the Hopeful Futures appeal help you in terms of early diagnosis, clearing the cancer backlog and other areas?
So, first of all, Suzy, I think it's very important that I thank everybody that's already given to the campaign. We are incredibly lucky. We have a very generous community, both with their time, their willingness to tell our stories, and also helping with funding, to which we are really, truly grateful. But we do need to start investing in early diagnosis as a new area for us. We want to invest significantly over the next 3 years. In the immediacy, we've got a new early diagnosis tool that we need to disseminate out to GPs, so that, as Graham says, we start to tackle the 120 days it takes for someone to get diagnosed with myeloma from their first presentation to doctors. So educating those doctors and giving them easy tools to use is a really important part of what we're doing. Secondly, we've got a fantastic new model, the Costello model, which we are trying to get published. And what that demonstrates is economic benefits of government investing in potential screening or tools so that early diagnosis can be done, because it will save money versus people presenting at emergency A&E. And thirdly, for the first time, we want to actually invest in research in early diagnosis to really start to understand what some of the barriers are and what could be put in place to help. So it's the kicking off, it's the pump priming, if you like, of the early diagnosis programme. Outside of that, we absolutely need to give patients a voice. So all the work into policy to make decision makers hear what is happening for myeloma patients, and supporting the clinical community in some of the changes that have been made, and trying to make sure data is available to underpin changes to both into the long term and the shorter term, and make sure that that information line, that psychological support, that ask the nurse, that trusted source of information is available for all patients in a very fast moving environment. So we'd be very appreciative for anything that anybody can help us with.
It's worth saying that the info line is available. We've run out of time for more questions, but if we didn't answer your question, or if you've got something that's a bit more personal to you and you would like to speak to somebody, the Myeloma UK info line, 0800 980 3332. 0800 980 3332. You can also email a question to fundraising@myeloma.org.uk. I would like to say thank you to Laura and Graham and Scott. Thank you so much for all providing your very different perspectives. Absolutely brilliant to hear from all of you, and best of luck, Laura, with the fundraising. I also want to introduce now Mark Gordon, who's with us, a very dedicated, very passionate member of the Myeloma UK board for the past 9 years, I think. Mark's recently retired as chair, and he wanted to say a few words. So it's over to you, Mark.
Thank you very much. That's extremely kind of you, and what a wonderful way you led the conversation over the last 45 minutes. Absolutely fascinating. And to you, Scott, Laura and Graham, I mean, the way you've spoken has been fantastic, incredibly eloquent, very concise and very clear. And actually the key takeaway for me, and I think this is the thing about Myeloma UK, is that Myeloma UK makes an impact. We do make a difference. In fact, there's no point being a charity if we don't make a difference. We've got objectives, we know what they are, and we have a great track record in meeting many of those objectives. And that's what's fantastic about Myeloma UK. And notwithstanding the fact that we've had a hell of a year, if I'm allowed to say it's a hell of a year, and patients have been under incredible pressure, so eloquently spoken about via Scott and indeed Carmen and Paul in the films. We've still made a difference during this year. Graham mentioned the 3 treatments that have been approved by NICE. Scott's mentioned the fact that he's on a treatment that, were it not for the fact of Myeloma UK's involvement, wouldn't have happened. And that's even during COVID. The fact that the support that Graham says that we've given to many of the other clinicians and nurses, the fantastic, the peer group of Graham's, of clinicians and nurses throughout the country, has been invaluable to them and has been invaluable to patients and carers. And again, it's made a difference. The work that we've done on clinical trials to discover new ways of treating people, the new methodologies, the orals, the injections that have happened that wouldn't have happened beforehand. Again, it's a lot of that has been thanks to us. I think the other thing I'm incredibly proud of, and that again, when it comes to fundraising, it's an incredibly important part that we need to support, is that continuing support we give through the written materials, through the info days, through the information we supply to patients. Scott talked about it a lot. The only place he goes to, essentially, the only place to some extent he's advised to go to, because the information is quality. It works. And we will continue to do that, and we will continue to improve that. I suppose I'll pick up from Laura just to end. You know why we're here. We're here for creating hopeful futures. We're here for this campaign. We need your money, to put it bluntly. But the point is that if you give us money, and many have already given on this campaign, you know that your money works. I come from the financial services background. They say past performance is no guarantee of future performance. True when it comes to financial services. But when you look at the track record of Myeloma UK, it has delivered, it has made changes, it has given improvements to patients, their carers, their families, to the clinical world, year in, year out, with all sorts of innovative ways of dealing with things, and indeed now focusing on early diagnosis, or refocusing on early diagnosis under this environment. So please give. It will make a difference. Your money will make an impact. It will help people like Scott, like Carmen, like Paul, and the rest of the myeloma community that follows us. And as Laura said, we have an amazing community. It's not only the patients, it's you also as supporters, our donors, and you have done wonderful things for us. And I hope that, and I'm sure you will continue to do so. So thank you to the several hundreds of you who've joined us tonight. It's been really, really wonderful. Thank you again to Suzy, to Laura, Scott, and to Graham. And thank you, of course, to Maureen, our patron, for her lovely words right at the beginning. So please give generously. myeloma.org.uk/hopeful futures. Thank you very, very much indeed. Really appreciate it.
Thank you very much, Mark. Just to reiterate then, myeloma.org.uk/hopeful-futures. Your donations will make the most extraordinary difference to myeloma patients, to doctors, to families and friends of those patients, and give people a hopeful future. Thank you so much to everybody for joining us, and do have a wonderful evening. That's it from us. Thank you. Bye.
Suzy. Bye.
Bye.